right, so we'll go ahead and get started. Hello, Dr. Curcio. We're really excited to welcome you and to interview you for our program to discuss the needle anxiety program at UCLA and just learn a little bit more about needle anxiety and what you've learned about it, specifically within the context of the neurodivergent community and the disability community as well during the COVID-19 pandemic. My name is Layla, and I'll be interviewing you today along with Lucia Juarez, Julie Gracian, and Nilpa Shah, who are also working on this program. And we're specifically interested in learning about your perspective as a physician working on the needle anxiety program and what we can learn from this program as we try to increase vaccine confidence in the disability community. Before we get started, for anyone who's watching this video, I would just like to introduce you. So Dr. Eric Curcio is a primary care physician, and he specializes in internal medicine and pediatrics right here at UCLA Health. He received his medical degree from New Jersey Medical School, and he completed his residency at UCLA School of Medicine. So with that being said, are you ready to get started, Dr. Curcio?
Absolutely. Thank you for the introduction.
Wonderful. So first, we would just like to hear a little bit more about the needle anxiety program. Could you tell us a little bit more about the goals of the program in particular?
Yeah, absolutely. So this was a project that we had or it was really a problem that we knew that, we needed a better solution for years now. And it probably was about 2 years in the making between when we first sort of envisioned it. And it kind of started as a multi-tiered approach, really. We knew that basically we could be doing a better job with procedures and fear for everybody, really. There's so much anxiety that doesn't get talked about, and probably a common reason why people maybe skip out on those physicals or miss appointments for people who have, serious deep-seated phobias from needles. Now, there's certain groups particularly disadvantaged by this. I think what we saw that really prompted us to try to find this solution was a lot of Dr. Quo and myself take care of patients with a variety of medical conditions, a lot of developmental delays, neurodiversity, and those patients in particular were really getting suboptimal medical care. It's these kids and adults on seizure medications that they need to be levels monitored and liver tests, things like that. And you'd look back and you'd see years had gone by, then none of these tests had been done. And when you look at the notes, it would always be, unable to get blood, because, those patients are at, particularly high risk for not being able to explain or understand the procedure sometimes. And it was really a problem that we had seen. What had been done beforehand would be this sort of wait until they needed something major that required like anesthesia. So maybe they were going in for major dental work or something. And when they went in for that, you'd quickly do their blood, vaccines, and everything else. But that's a disjointed way to do it. And sometimes you might wait years for something like that. So for that sort of second tier of the program, the first tier was really just coming up with ways for everybody to have our nurses trained better, to have explaining procedures, to give patients some control and how they kind of wanted the procedure to play out. They wanted a distraction, they wanted music, things like that. We came up with sort of the second tier of our program, which included things like the Buzzy Bee for children and other distraction techniques that would be done at specialized times. We'd often have one of our psychologists here to be involved and kind of do those higher level things. And then the area that's probably gotten the most attention is that third tier, which are some of the most challenging cases, but the most deep-seated intense phobias where patients with developmental delays really couldn't understand the procedure. And that's what we started doing intranasal as basically as an anxiety medicine that could be done right before the procedure and really have a calming effect. It doesn't work for everybody, for sure, but we have had quite a bit of success. So, Alice Poe, I think, kind of came up with the idea sort of behind it and identified the need, and then I did a lot of the work more on the implementation side. I tend to be the operations guy. So, we did a fair amount of literature searching to see how other health systems had handled this. There's not a ton out there. We kind of based our model with a few things we found from dental literature for doing sort of mid-level procedures for patients with dental, procedure phobias or developmental issues. There were a couple of case studies from pediatric echocardiograms that had used Versed, but we couldn't really find much of anybody who had used it for this specific need. But it seemed logical to us that it would translate over. So borrowed some of those protocols that we were able to find, and then almost a year ago started doing our first tier 3 intranasal procedures August of last year. Like I said, after about two years of figuring out all the processes, getting anesthesia, ambulatory nursing, and everyone else to sign off, because first and foremost, we needed to do it safely. We needed to have good emergency plans in place. But what we found, and what we also read in the literature, is if done right and the protocols followed, it really is extremely safe. And we haven't really had any negative interactions. Yeah, that's a little bit of the backstory, I think.
Yeah, it seems like you've developed a really comprehensive program that caters to the needs of a lot of different types of patients. I'm curious, kind of in your experience working with these patients, what are some of the underlying reasons that patients have provided surrounding their needle anxiety?
Yeah. Probably when you ask most people who have that deep-seated needle anxiety, most can't give you a good reason why they have it. There's just a subset of people out there that have these phobias. Some have had a bad experience. There's a subset of people, and we see it about once a week here, of somebody who every time they get their blood drawn has a fairly high chance of passing out. It's completely beyond their control. It's not an anxiety issue. It is just a visceral response their bodies have, where all of a sudden they drop their heart rate and blood pressure afterwards. That's a subset. But like many phobias, people don't really know why they have it. It's not usually a bad experience from memory, but probably something maybe dating back to childhood, maybe that they can't even remember. So on the phobia side, and that's probably about half of the patients that we see are more in that phobia group that have been putting off vaccines, putting off procedures with blood draws because of that. And then the other half is really more in the neurodevelopmental disabilities group. These are patients that can't understand necessarily what's happening, or have trouble calming down, maybe have already some either ADHD or other hyperactivity kind of conditions. There's really a lot of different things that can come up. And in that group, it really is just trying to make the experience as pleasant as possible and as a productive experience for them, because once they learn that this place is associated with pain, or this place is that scary place where people come in and hold me down aggressively or something like that, that's really hard to undo that kind of damage. And now they're going to have that fear probably walking into every medical office, because they all kind of look the same, potentially for the rest of their lives. So we want to do what we can not to create more phobias inadvertently from negative experiences. We do hear that a lot from parents, that, oh, the last time we had blood drawn, we had such a big setback, and their anxiety levels spiked so much because they went somewhere where they had a bunch of people grab them and hold them down, and no, that's not humane treatment for anybody.
Mm-hmm. Yeah, thank you. And I'm curious to hear for either other providers or for anyone listening, what is kind of something important to know regarding working with families or patients with disabilities regarding needle phobia, while still promoting vaccinations and inoculations?
Yeah, I mean, for starters, I'd say the most important thing is nobody likes surprises. So, as much as we can, keeping the, developmental level of the patient in mind, the more we can explain up front, maybe walk through the scenario, talk through how it's going to go. I think, a lot of times parents do the opposite sometimes, or caregivers will do the opposite, where, oh, I don't want to upset them, so we'll just bring it on them last minute. Nobody likes that, right? It just breeds mistrust. It's going to make that phobia that much worse. There are books about this, there are pamphlets, there are online resources out there, that you can use to really talk through how the scenario is going to go. Talk about if it's the way that we're going to do the nasal reset. We're going to feel a little spritz of fluid in your nose. Maybe try that at home with a nasal saline spray over the counter, just to kind of, really build that confidence of knowing what to expect. So I think we found that the cases go best when patients know sort of what's coming, they've talked about it before, they've walked through it as much as they can. So that honesty is definitely an important step. We also want our families to know that this is not a cure-all, right? So if there's somebody who's so extremely anxious, this one dose of a anxiety type of medicine isn't always going to be enough, and we can't do repeat doses because that gets more into the safety side of things. So it's not going to work for everybody, but we figure if this can work for half, 2/3 of cases, then we'll still have to figure out that other case, probably working with anesthesia. And we are trying to explore some of those drops right now, but it is tough.
All right, wonderful. Thank you very much. And just to kind of elaborate from that question, can you tell us a little bit more about how you communicate with patients directly surrounding their needle anxiety or getting shots in particular?
Yeah, absolutely. So, this might be a lengthy process. It might just be at the time of the visit if it was sort of an unexpected thing. But, a lot of times people will either directly voice concerns, or a caregiver or family might, but a lot of times it's more in the subtleties of, you say blood and you see them kind of recoil or say, oh, can we do it another day or something like that. So you get this that there's something going on, and then you can just try to have an honest conversation. I see you maybe a little bit nervous about the vaccines. Did you have a bad experience before? Did you have some fear? Because it might be about the needle, or maybe it's just concerns about vaccines in general, or concerns about medications or something else. So you kind of need to tease that out. If it is about the needles, I think it really is reassuring to a lot of patients and families to know that this isn't something that we're just brush them off, roll our eyes, and say, oh, really, it's mechanical blood draw. No, this is something that we identified the problem. That this is an extremely common kind of scenario. So we built this program around it, and I think a lot of times, knowing that our nurses are trained in this. This is something we do often. You passed out once, great. We're going to have some juice for you. We're going to have you lying down. We're going to watch you for a while afterwards. Just those kind of things alone, that we're going to listen to them. We're going to take it seriously, and that we've heard. I think can make a huge impact right there. Again, if it's something that's going to be more of a planned thing, where we're going to bring them back now for the first cut or something like that, we'll talk about why we do this, how it works, what to expect. It's a funny feeling getting this solution sprayed into your nose. From what we hear, burn is quite the right word, but it's a odd sensation, I think. So making sure patients know to expect that. And then, encouraging them to do, whatever is going to help calm them down the most. It might be something like a buzzy bee or a distraction technique for a kid. This might be the time where we make the exception on the screen time, bust out those YouTube videos, or whatever else is going to help someone calm down. Maybe there's somebody who really likes music, and with some headphones on and distraction that way, maybe that would be what kind of gets them to the procedure. But it's kind of, like anything else, the making process where you just lots of options and come up with a plan that everyone's comfortable with.
Mm-hmm. Mm-hmm. I see. And has this sort of communication or this sort of approach changed when you're talking in context of the COVID-19 vaccine, or just in the pandemic times in general?
Yeah, I mean, COVID certainly heightens everything a fair bit more. When you look at the rates of people who are passing out after vaccines, which is not almost certainly related to the actual vaccine itself, it's more related to the needle and everything. The rates are much higher for this. I think it just kind of speaks to that extra level of anxiety that everyone really has about COVID. There's a lot of information out on web and in the news that is often not that accurate. It's sometimes a political issue and other things that's really just left people unsure, undecided, extra nervous. They've heard that somebody they know had a really bad reaction to the second dose, and now they're extra, nervous about it. But when we look what's happening here now, and that we finally seem to turn things around and allowed reopenings, we know that's pretty much all what's happening in countries that have not been as quick to roll it out. So people at the same time know it's important. So it creates this kind of dissonance, I think, where they know they need to do it, but they're also extremely nervous about getting it done too. So it is a good opportunity, I think, to just, all the things we just talked about, all those different tiers of comfort and reassurance, coming up with a plan, even more so for that. And we hate to have, fear of a needle be for the reason why somebody chooses not to get a COVID vaccine. If there's things that we could easily do that would probably make the procedure pretty benign. What we often hear from patients is that, their sort of mental image, if they've walked themselves through this in their mind of how horrible it might be, when they actually do the procedure, especially with some distraction techniques, numbing medicine, maybe whatever else is going to help them, the end result oftentimes is, oh, it wasn't that bad. And it turns out the vast majority of patients we see, phobia patients as well as neurodiverse or developmentally disabled patients, the vast majority don't ever get to that tier 3. They don't end up needing the anxiety medications. It's really just behavioral approaches can take care of most of it. But COVID has definitely sort of shined a spotlight, I think, on all the fears surrounding vaccines even more so.
Mm-hmm. And kind of amongst these, many interactions I'm sure you had, do you have any particular anecdotes or particular patient interactions through this program that you would be comfortable sharing with us and with the neurodivergent community?
Yeah, absolutely. From last week, have one of about 14-year-old with kind of a rare genetic condition that, as part of it has a developmental disability component to it, but had some trouble before with vaccines, to the point where we had actually talked about maybe getting to that tier 3. But we ended up bringing him in with dad there for support, with some good distraction techniques, with the iPhone out and favorite videos playing on, I think it was a TikTok day if I remember right. And it turned out with those distraction techniques, a little numbing medicine, he had a completely pleasant experience. Barely even noticed that he had gotten the vaccine by the time it was done, and left here, with some stickers and a smile on his face, not having that negative association. And that's going to make our life so much easier next time he needs boosters, for his meningitis vaccine, that's something like that. And I think it was good for the family to kind of see that, with these sort of interventions and having support present, and again, no holding down or restraining or those kind of things, that we were able to do it safely, that we were able to get it done, and not in any sort of a stressful or more anxiety provoking way. So. And I think we all, if you ask the other doctors, I think we've all got examples of these sort of success stories. We do thank one of our child psychologists. This was a passion project. We did a lot of training with the nurses, the medical assistants, not just in our office here, but kind of our med-peds offices all across LA.
Yeah, no, it seems really important to build an environment in which you're not provoking further anxiety, but helping to ease the patient while also providing them with quality care and getting them all the procedures and all the inoculations that they need. And so when it comes to context of younger or for neurodiverse patients in particular, how do you as a physician weigh the benefits and the risks of the COVID-19 vaccine for those patients that may have needle anxiety?
Yeah, I mean, well, we know the benefits are potentially huge, right? We know that patients with autism, patients with developmental delays, we're seeing worse outcomes with COVID pretty consistently. They were getting diagnosed later, they were getting tested later, and you wonder why that is. I mean, it could be access to resources, but sometimes it might be even some of that same anxiety that's kind of playing in on the patient's part, on the parent's part, or a caregiver who's now even more afraid to bring them in because now they're going to get this nasal swab that we know is uncomfortable. Oh my God, they're going to go into the hospital. We know how disruptive that's going to be to their routine, because that is disruptive to anybody, and especially somebody who maybe can't completely understand what's happening or something like that. It's extremely fear-provoking. But what's the end result is that we're seeing higher rates of death, higher rates of ventilator use in patients with those types of disabilities. So the benefits are huge, and the risks of not getting treated early, or the risks of not getting the vaccine, and exposing more COVID risks on the road are huge. So I think it's a hurdle that needs to be overcome and taken seriously to build that support. But I mean, it's so important. I think that patients not put off important medical procedures out of fear of something that, if done right, probably shouldn't be all that fear provoking, at least for most people.
Mm-hmm. Thank you very much. And we've discussed kind of the context of younger patients and neurodiverse patients, but I'm sure you work with patients across kind of all age groups. And so how does your approach to discussing needle anxiety and more broadly their care as well, along with the ramifications of any sort of procedure, vary depending on the age of a patient?
Right. I mean, there's, obviously everything you do has to be developmentally appropriate for whoever you're talking to. I think, it highlights the need for a sort of family-centered approach a lot of times for, obviously it's a very different discussion if we're talking about a newborn who, or a couple of months old who needs vaccines. A lot of times that's going to be reassuring mom. It's going to be maybe letting mom nurse right after the procedure to calm down, maybe letting her hold the child on her lap rather than, kind of being on this table or something where it's more intimidating, where mom feels more removed from the situation. And then the discussion is going to be different with a school age kid, where maybe we could encourage them to, again, tell the child ahead of time, because now the child knows and is asking that question. We never want to lie to them. We don't want to build any distrust there. And maybe if we know this is a child who has a major issue with vaccines, trying to again with a neurodevelopmental disability or something like that. It really is meeting them where at the level they're at with the understanding they have, giving them a chance to answer, ask questions that they have and get those concerns addressed. And still being there to support the families because oftentimes they're equally as nervous about the whole situation as the patient too. But we see needle anxiety through the entire age spectrum. We have plenty of patients in their 70s, 80s who also still hate needles, right? This doesn't go anywhere for most people. If you're one of those people that are affected by it, this is going to probably be their, something that you have to deal with, for your whole life.
All right, yeah, thank you very much. And you mentioned, particularly for children, kind of incorporating their parents into that procedure or just building an environment in which they're more comfortable. I'm curious if you have any other advice specifically for a parent or a caregiver to assist their children that have needle anxiety, either at home or at the clinic.
Yeah, I mean, and it's, family is an important part, probably regardless of age too, for a lot of people. Having a support person there can be huge at any level. Again, I think it's just taking some time to think about what could we do that would put, this patient at their most comfortable. And maybe it's going to be bringing a, support object, or if we have a favorite toy, or if we have something that we can, a blanket or something in a younger kid that we can have with us for support. Occasionally we've had people bring their emotional support animals, and if that's something that kind of helps them out, great, whatever it's going to be that's going to get you through a spot. And it does have to be customized, I think, to a lot of points, because everyone's going to have different, distraction methods that they work. Some people want to meditate. Some people have a really tough time doing that, and it stresses them out more and want to go more with music or something else. There's no kind of one size fits all approach. I would say it's definitely customized to the individual.
Right. And I'm just going to move a little bit more broader and just hear from kind of your experience working with patients. What are some kind of comments, questions, or factors about needle anxiety that, in your opinion, are the most important when it comes to raising awareness, either about the issue of needle anxiety itself, or just to the fact that there are resources for people who have needle anxiety amongst the community, if you have any kind of thoughts or opinions on that?
Yeah, I mean, it's tough because one of the hallmarks of phobias, I think, in general, is not wanting to talk about it, right? We tend to avoid things we're afraid of. So a lot of times people won't really voice those concerns, to patients. We just encourage everyone, like anything else, just to be open and honest, with your medical team, with the doctors and nurses taking care of you, because guaranteed they want to do what's best for you, and they want to do it in a way that's going to make you most comfortable. And on the other side, I think providers might, somebody didn't, oh, this is the third time you're back, you still didn't get that blood work done, and taking that step back to try to dig into why. You might be surprised at the answers you find. Maybe it's logistics. We need help on the social work side to get transportation or get support or something like that. Or maybe it will uncover that it's just a bad experience that happened before, or a fear of one of these deep-seated phobias, or that bad experience that happened as a kid, or whatever it might be. So just really trying to keep the communication open both ways, to be aware that it's a common issue, to be aware that it's a common cause for why people are getting suboptimal health care, and then just be willing to kind of start those dialogues.
And then just based off of your experiences, what are some of the kind of biggest myths or stigmas surrounding the intersection between vaccine hesitancy and neurodiversity that should be broken?
Yeah, I mean, probably not so much related to the needle side of things, but we all know there was a lot of, scare and fear put in by some studies that were, later discredited, specifically around, the MMR vaccine and autism, and that kind of got broadened out to many other vaccines and things like that. And despite, countless studies and excellent research looking at huge groups of populations disproving that, beyond a shadow of a doubt. And that study having its own ethical concerns and being recalled and retracted. That fear is still out there. And I mean, the last thing any parent wants to do is do something that could possibly hurt their child or take even the slightest risk. And I think because there's still a ton of misinformation on the web out there that people you kind of get inundated with on social media, on news sites. And then you don't see so much of polio and things like that because luckily vaccines have done their job, and those case rates are really low. It puts parents in these tough positions where they see a lot of negatives and then the positives are not quite as obvious. I think again, it's having that dialogue. It's trying to get to the root of a person's concerns. Was it an article they read? Was it something their friend told them? Is there some better direction we could point them to give them some of the good information that is out there and give them, the things that reassure us as physicians that what we're doing is safe. And I think a lot of times, as parents read into that more, that can help reassure them. It's scary. I mean, nobody, when it comes especially to taking care of family members and children, I think we're even more nervous about doing anything that could cause harm. But every parent, at the end of the day, wants to do what's best for their child, and they're just trying to navigate the information that's out there. And I think if we can remember that and just try to move that dialogue further, that's going to have the best outcomes, getting people to, at least think about vaccines, to, if they are hesitant, to maybe come up with a plan or kind of take them one by one and look at the research and the safety data out there. And when most people see the real data, it is pretty reassuring. There's a reason why the medical community is as confident as they are about these things.
All right, and I just have one more kind of broader specific question for you. I was curious to see if you had any advice for providers or other healthcare professionals who may not have a formal needle anxiety program on how to approach or communicate with patients who have disabilities and who have some sort of needle phobia.
Yeah, it's tough. I think the lesson is that you don't really need a very formal type program to do probably 80% of the work. They're quick skills that we already have. Time is one of the biggest things, and I think that's something that all physicians struggle with. You have these shorter and shorter appointment times that are often dictated by the health system, and when you're rushing these things, sometimes you're the first to go. That taking that extra minute or two to really get to the root of a problem. But at the same time, we know that's the source of a lot of healthcare disparities then for groups that, neurodiverse patients, patients with disabilities. So, being thoughtful that, this needs to be addressed, not maybe at every visit, but, periodically to check in is important. Maybe scheduling those patients for a little bit of extra time, maybe doing that prep work ahead of time through an email or something like that. So a lot of the work's already done beforehand can be huge. But I would, I think all of us are trying to provide, the most, equitable care that we can, and this is part of that duty, really.
Thank you very much. That's really great advice. And hopefully we'll be able to, or this type of program or this type of approach will be able to be implemented across the nation and be able to help people who have needle phobias. And then, great. Yeah. And then just last thing, I was wondering if there is anything that I haven't asked you or that we haven't discussed today that you think would be important to share with the neurodiverse community.
Yeah, I mean, I think we touched on kind of a lot of the highlights, but again, I think the most important thing is just communication, right? And it could be generalized to many, many things beyond this, but patients are often hesitant to have these conversations with doctors, probably fear of judgment or a negative experience maybe that they had with another healthcare provider before. But to get the best care you can, the most important thing by far is to just have that open communication with your physician, to be able to talk about the awkward things, talk about the things that are inherently anxiety provoking. As tough as it is, knowing that nobody is here to make any judgments, and everybody is working towards the same goal is probably will help you get the most out of healthcare in any setting, really.
Thank you very much, Dr. Curcio. That was the final question that we have for you. But otherwise, we really appreciate you taking the time out and to come talk to us and to our community as well about needle phobias and the program at UCLA. And hopefully more and more people will be able to take advantage of the program.
That'd be great. Thanks so much. Let me know if there's anything else I can help with.
Wonderful. Thank you.
Bye now.